side effects, some challenges with side effects that you've gotten to deal with, and how do you handle those challenges?
When a patient calls stating that they have rippling or they have a bump or they have something or they have hurt, right? First of all, I want to see them because I want to see what's happening with that thread. You can get a lot of visual. Yes, you can have them send a picture, but I have them come in so that I can see the problem. If it is a bump or a lump, I can strap it down. Mono threads in there at a star level or a hashtag over a bump, and I can push that down because the bump is the actual thread coming up through the skin. So if I can level that out and push that down, that'll be fine. That takes about a week. So that I just reassure the patient it will go away. Most people are okay with the side effects. Knowing that you can do something about it as a practitioner, they feel much better with it. If it's a kink in the thread, you may have to make a nick and pull it because maybe you placed it too superficial or too deep. So there's ways of you can just nick the skin with an 18 gauge needle and get in there and handle it. Worst case scenario is that we have to take a thread out. And you know what? We can do that very easily. We have skills and you take it out and then you place another one at another time. Mostly it's maybe lumps and bumps that are going to occur because as movement happens with skin, those threads are going to move as well. So that's why I say facial rest after you have threads, because you don't want to keep moving that thread around until it's set in the skin. So all these little things I develop, I have a technique where I use a cannula. So if a thread's sticking up or it's wavy, I push it down with a cannula so that we can get it to lay down a little flatter. So
Mhm.
there's always things that you can do with this. It's laying right underneath the skin. It's not like anything major that's going to do harm. So there's not any long-term major side effects. It's only the short term of, hey, we need to conceal this little lump and bump or this waviness. And you can most likely use your small threads to actually do that. And that's what we teach in our courses, not only how to place them, but we need to teach what are we going to do if we have a side effect? And this is how we're going to fix it.
Yeah.
I think when, as injectors, you want to go into doing threads, patient selection should be key. If you know that patient is a picker, I'm going to be very cautious about doing threads, or I'm going to do the PDO threads that will dissolve in the skin faster. I'm not going to use a PLLA or PCL. If you have high mobility in a mouth area, then I'm going to use maybe a smaller thread, not a bigger thread. So your patient selection has to be good before you actually engage into the procedure. So you're not having the side effects afterwards. If you know a patient is going to go out and play pickleball an hour later, she's going to be potentially exercising. She's going to bleed. She's going to bruise.
Yeah.
Bleeding, bruising, swelling moves threads. Activity moves threads. Nothing with your mouth wide open. So we go into all these things post treatment with patients before they leave. I also give a little drop of steroid, and that helps some of the swelling go down a little bit faster on a lifting patient. But for the most part, talking them through with that and educating them that facial rest is very important. And this is why it's important. Because when they come back for those side effects, what do I have to do? Now I've got to see where that thread is. Did it move? And people get crazy about, yeah, I'm going to move my face. You know what? That's fine. And the thread's going to move too. Who cares? It's still going to build collagen. It's still going to pull. You didn't ruin the thread by yawning. It is laying underneath the skin. It is going to have a little bit of movement and it's okay. It's not detrimental. It didn't break. It didn't move.